Hi, my name is Dr. Mike Debord. I'm the president of B3 Sciences, and I've got an exciting presentation for you. Over the next 7 to 10 minutes, I'm going to share with you a scientific breakthrough in exercise that is going to be perfect for your amateur athletes. You know, this is what we believe on amateur athlete training, and I've got a son who's a Division I football player, so I watched him go through this. This is the typical training that our young athletes do, and they do this for an hour or more. They lift weights for prolonged periods of time, or do long running or sprints, or do long sessions of speed training, and obviously sport-specific training. And the concept of this type of training is go to maximum failure exhaustion, and if there's no pain, you're not going to gain. And this is what our programming tells us. When we do this high-intensity, long-duration exercise, we're pushing our body to exhaustion. It micro-tears muscle in an attempt to build the muscle back bigger, stronger, faster, more explosive, and to have better performance. And of course, we know it requires a recover period. It takes at least 1 to 2 days to recover from a very intense, high-duration training session. But here's what really happens. As you exercise muscle, whether you're lifting weights or doing sport-specific training or sprinting or running, lactic acid builds up quickly as a byproduct of muscle metabolism. And you start to feel this as the muscle gets into this acid state and it gets hypoxic or starts to get low on oxygen. You start to feel a muscle burn. Every athlete has felt it. The problem is 99% of athletes can only get that muscle oxygen down to about 30%. But when they do this, they start to recruit all the muscle fibers, not all of them, which is important, but they start to recruit both types of muscle fibers. And what happens? The muscle metabolically fails. It rarely fails based on load. It fails because it no longer can deliver the oxygen the muscle needs, and the muscle just fails. And the athlete knows this because they can't go any further or they're close to exhaustion. And then the body needs to recover or go through a recovery period. And we know that there is adaptation that occurs. And this is what we call slow adaptation. The muscle slowly gets bigger. It slowly gets stronger. Your athlete has more endurance or gets faster or gets more explosive. Well, now there's a scientific breakthrough called blood flow resistance training. It came out of Japan, discovered in 1966, and became popular through the Asian Olympic athletes and bodybuilders, and now it's made our way to the United States. And what this does is this completely changes how our athletes can train. It cuts their hour-long workouts to less than 20 minutes. It dramatically reduces the weight. And what it does is it safely slows down the blood supply out of the working muscle by putting these bands on your arms and legs. Doesn't cause any health problems, doesn't cut off blood in any direction, but it slows down the blood supply. So as this muscle starts to work in the first few minutes, the oxygen quickly gets down to under 30%, close to 15 or 20%, and the muscle quickly fails. But here's the key. This is less time and less weight, which is easier on the athlete, allowing them to go to further exhaustion with less work. And two things happen. Most important, when athletes get their oxygen down to this level, there's a significant growth hormone change or a much greater growth hormone surge. And then second, this further exhaustion, this safe and further fatiguing of the muscle, along with this growth hormone surge, results in a different type of adaptation. And it is fast and it is profound in your athletes. Now, here's a study on a muscle before using the bands and after using the bands. On the left, this is a muscle doing 25 arm curl exercises or bicep curls. And as the muscle starts to get tired and fatigued, you can see the oxygen level there is getting down to about 30 or 35%. This is good exercise, but this is not going to create a significant growth hormone surge and a fast and rapid adaptation in the body. Over on the right side is the same exercise, doing arm curls, but wearing the B3 or BFR bands. And what happens is the muscle's oxygen drops rapidly. Look how low the oxygen's getting in this muscle. It's actually getting below 10%, which triggers a significant impact in the body. And here's what happens. Down there at the bottom left, you see the muscle working, and you've got this blood flow restriction device that's only affecting the superficial venous structure. Again, it's not cutting off blood supply in either direction. It's completely safe. But the muscle gets in this metabolic crisis, and this oxygen level gets low in the muscle. And the muscle sends a signal up through the neural pathway that says to the brain, help, we have a muscle that's under severe exhaustion and metabolic failure. The brain responds by increasing heart rate, increasing breathing, increasing sweating, and releasing growth hormone. And here is a study proving it. Exercise without blood flow restriction training produced a small increase in growth hormone. This is what typically happens in our athletes. Exercise with blood flow restriction increased growth hormone 25 times greater. Doing the same exercise results in a 25 times greater release of growth hormone. And this growth hormone is like putting your body into hyper fitness mode. The adaptation is profound and the adaptation is quick. Here's a study, one of the studies coming out of Japan, showing that lightweight exercises with elastic blood flow resistance bands like the B3 bands is equivalent to improving strength just like lifting heavy weights. What this proves is your amateur athlete can switch to light weights and get the same or greater improvements in strength as if they are doing heavy weights. And we all know this would be beneficial to most athletes to reduce load and reduce stress. Look at this study. It shows that within 5 sessions of doing blood flow resistance training, there's a meaningful increase in strength and size. This typically takes 20 to 30 sessions, 60 to 90 days in athletes. Here it's happening literally within 2 weeks doing 5 sessions. And again, when you see some of the testimonials we'll share with you in a minute, this is what blood flow restriction is doing. It's getting a profound increase in performance in our athletes, and it's happening fast, and it is safe. And here's a study done on 12,000 people who used blood flow restriction training. And here's the safety summary, that it is safe for healthy people, and it can even be applied to persons with various kinds of physical conditions, including cerebrovascular disease, orthopedic disease, obesity, cardiac disease, neuromuscular disease, diabetes, hypertension, and respiratory disease. We have cancer patients using these. My 80-year-old hypertensive mom exercises with these. My 11-year-old stepson exercises with these. They are completely safe. Here's a summary of what the research shows which is beneficial to our amateur athletes. Number 1, it can promote a significant growth hormone release. Number 2, it's less muscle damage and shorter recovery. Wouldn't we like our athletes to rapidly adapt but do less damage to their body and have less recovery time? This does it. There's a noticeable increase in strength and size of muscle. Metabolism goes up and fat burn goes up. There's also an increase in VO2 max, or the ability for the body to use oxygen by simply doing this exercise, and it's safe as regular exercise. We're talking about hyper-fitnessing our amateur athletes with half the work and half the time. These revolutionary B3 bands can be worn by anyone, anywhere, anytime, any sport, indoor, outdoor. They're waterproof. They come with a 6-month warranty. They're durable, and they are washable. And the results are absolutely amazing. Now, in a second, we'll talk about some amateur athlete results performing better. But for the general population, we're talking about getting in shape, losing weight, toning up, athletes building muscle, performing better, and recovering faster. Plus, a wonderful anti-aging benefit for adults. Here is my son. My son, Colin Debord, is now a Division I football player. At 17 years old, he had kind of maxed out on his speed. And 60 days before he was getting ready to hit the camp circuit and then go to the U.S. Army Combine, we implemented the bands, the B3 bands, into his speed training. We reduced the amount of time he did his speed training from 20 to 30 minutes instead of an hour, and we simply put the bands on. And he noticed a greater exhaustion, but at the same time, he recovered faster. His 40 time measured by a laser went from 4.65 to a 4.5. He was the 7th fastest kid at the U.S. Army Combine of 700 kids. And look at that Ohio State football camp card on the right side. That second 40-yard dash time is a 4.35. He went from a great speed kid to an elite speed kid and absolutely blew up with scholarships, and his top end speed went from 19 to 21 miles per hour. All we did was add the bands, hyper fitness, and reduce time. Here's Evan. You want to build muscle bigger? Evan is 19 years old, and he was having a challenge, put on weight. He switched to the bands and put on 20 pounds of muscle in 4 months, and his strength skyrocketed. Are you a volleyball player or a person who needs to jump? Emily is a Division I college volleyball recruit. She's a senior. When she went through this, she had been capped out on her vertical jump at 9'7". She put the bands on and started doing her jumping drills with B3 bands, and in 6 weeks, she put 6 inches on her vertical leap. This is an elite level volleyball player that added 6 inches to her vertical. That is absolutely unheard of. How can that happen? You take an athlete that in their sport of jumping and practicing volleyball, it's great exercise, but muscles don't fail during the practice of the sport. Now she's jumping and digging and doing 3-step block jumps, and her muscles are failing. They're going way further than they've ever been pushed, and safely. Of course they are going to adapt. And here's a world champion martial artist young guy, Vinnie, who now trains and spars with all 4 bands on his body. He now, when he lifts weight, does it in less time, and he recovers quicker. And he'll tell you that his sparring, his kicking and punching has become noticeably better by putting the bands on not only when he lifts weights, but when he trains. And finally, how about rehabbing faster for our athletes? Josh is an MLS soccer player who had a second ACL injury that was going to take 9 to 10 months, which basically would have derailed his career. This time, he used the B3 bands and was ready to go back on the turf in 3 months. They literally would not let him back that quick because they had never seen somebody heal that fast. He was back playing full intensity MLS soccer in 4.5 months, half the time that it typically takes to rehab an ACL surgery. And he simply implemented the B3 bands quickly after surgery to start doing his rehab and progress faster. Well, we have a scientific breakthrough in training that is going to take teenage athletes, amateur athletes, and collegiate athletes and take them to a level of fitness and a level of performance that they've never seen before. And we can do it in half the time with half the work, and it's safe. And it even applies to injured athletes and rehab athletes. I want to thank you for watching this video. If you have more questions, make sure you get back to the person who shared this with you. Also, go out to our website and learn more about the B3 bands.